Let's get us started because we know we had a big change today. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber, and I want to thank you for joining us for this week's cross-industry support session. We'll also have a session at 4 o'clock today that addresses gyms particularly. So if you have questions that are particular to gyms, we're probably going to save those to the 4 o'clock session because we know we have a lot of questions and a lot of people on today's call, especially with the announcement that Boulder County will be moving to level orange, or what we've been calling up to this point, safer at home level 3, as of Friday, November 6th. Without any further ado, I'm going to hand it over to Jesse Rounds with Boulder County Public Health to walk you through today's presentation. Please put your questions in the Q&A or chat. Hopefully they'll be answered. If not, then I'll ask them on your behalf. If they're not answered today, we are going to be doing a special session on Friday at 1 o'clock. I'll send that information out. So as you digest this information, you understand it a little bit better, and you have further questions, we'll have another opportunity for you to address those questions live with Jesse, particularly on Friday at 1 o'clock. All right, Jesse, take it away.
Thanks, Corinne, and thank you everyone for jumping on. And I want to reiterate that there are, Corinne mentioned that you're digesting and understanding, and as are we. So we're working on this together. So as usual, I'll start with an epidemiological update. I do want to jump into sick employees and outbreaks because that's been an increasing concern for a lot of businesses, and so I want to go over that a little bit. But then we will spend some time on the dial status and public health order updates. Hopefully, answer as many questions as we can then. So, we're seeing the continued upward trend of cases of new cases in the county. This is the 5-day trend as of Monday night, Tuesday morning, and so that's driven a lot of the concern regarding the situation in the county right now. I wanted to include this because I think it's an important way of showing how the virus has spread across our communities and how it's impacting our communities differently. I think that's really important based on where your business is and the community it serves. Looking at an age breakdown. So in the past, we've had 18 to 22-year-olds broken out because they had such high spikes. As you can see, this chart just ignores those really high spikes from September, but shows that we're seeing increasing cases in every age group. And it's a pretty stark increase. So that's where a lot of this concern is coming from. The other place that I think is really important to note is hospitalizations. This is hospitalizations in Boulder County. And as you can see, again, in October and as we head into November now, we've just seen a very steady increase in hospitalizations, which reflects sort of the severity of what we're seeing. So our key takeaways, obviously case numbers are rising, and we're getting about 93 cases per day based on the 5-day running average. Our long-term care facility cases are on the rise, which is also a worrying sign, and case rates are going up amongst all age groups. Hospitalizations remain high, as well as our positivity rates increasing. And the troubling positivity rates are increasing amongst all age groups. So that's also a concern. Now jumping to sick employees. This is a thing that's come up a lot recently, and there's a lot of text on these next couple slides. I encourage you, if you have questions, feel free to ask them, but also the covid19.colorado.gov website has great information. I've basically taken what they have and tried to simplify it for these slides, but they really go through a lot of detail on what you can do. So if you have a single sick employee, you will probably not need to shut down unless you're a very small business. Send any sick employee home. These are employees that are either exhibiting symptoms or have tested positive. Informing fellow employees of possible exposure is important. you do need to follow HIPAA guidelines. You can't name the employee, but you do need to try and do your best to figure out other people who were exposed to that employee. And then cleaning and disinfecting the space where the employee worked is really important. You need to wait 24 hours and then clean that space. Thoroughly using disinfectant recommendations from the CDC and EPA. If you have a probable sick employee, and this really is if you have an employee who is exposed to someone else at at home or something like that, you need to allow them to quarantine for 14 days. If they develop symptoms, they should get tested and begin isolation if they test positive. If they want to get tested, but they don't have symptoms, they should wait at least 7 days since their last interaction with someone. And it is not necessary if you don't have symptoms, just wait the 14 days, and that's the best way. The 7-day test thing doesn't get you out of quarantine. You still have to quarantine for 14 days. And really, if you have a sick employee, we will reach out to you. Or if you have a probable sick employee, we will reach out to you. But you should also reach out to us for support. And if you have situations where 14-day quarantine isn't feasible or something like that, we can work with you on that. If you have an outbreak, and an outbreak is defined as 2 or more employees testing positive within a 2-week period, you will need to close the facility, and that's just a temporary thing. Basically, you're closing the facility, sending everyone home, and contacting us, and then we can work with you. You may not need to be closed for more than that day. If the employee's workspace was isolated, if we can identify all the people that they interacted with, there's no reason why you can't clean the space and reopen. But you really do need to reach out to us. We will do our best to reach out to you based on the the positive test results that we get back from our testing facilities. Really the key is to maintain your practices to keep the other employees safe. Really being flexible. People who are exposed, people who are concerned are going to need to quarantine. That's really important for their health. It's important for the community's health, and it's important for your coworkers, your employees. Just allowing that 14-day quarantine period to pass. All right, now the dial. So right now we're at level 2. This is the old diagram. They're no longer numbered, they're colored. So we're at yellow. On the 6th, which is Friday, we will be going to 3, what used to be 3, which is now orange or high risk. Just running through here again, these metrics are based on our position is based on 3 metrics. The number of new cases over a 2-week period per 100,000 people, our percent positivity, and our hospitalization situation. So, as you can see from this, the county is in that orange category. We have almost 300 cases per 100,000, and we're doing slightly better than the rest of the metro area, but not by much. And you can see the whole metro area is being impacted by this. Now, and we are now finally above a 5% positivity rate. That still keeps us in the yellow, but we're seeing higher than that positivity rates by age group. So that's a concern. And then finally, hospitalizations. We've had 10 days of decreasing or stable hospitalizations. And again, I mentioned this last week. There is this funny thing where we say we're seeing increased hospitalizations, and the state's saying, well, you're seeing decreasing. It's based on how we measure it and they measure it. We measure it differently. We're trying to really understand the capacity of our hospitals. They're trying to understand the impact by community. So it's a little bit different in how it's measured. All that said, As of today, we received notice that as of Friday, we will be going to the high risk category. All businesses will need to comply with the high risk guidance, which is available again on covid19.colorado.gov. I'll go over those now, but I think it's really important to dig into the new public health order and the guidance on the website. But two things I want to mention before we start going into sector by sector information. One, your practices need to remain the same. Cleaning, mask wearing, social distancing, anything else that, symptom checks, all the things that were required under Safer at Home Level 2 are now continue to be required under the high risk or orange category. The difference is capacity. So the recommendation from the state for schools is remote or hybrid model suggested. The decisions are made by those school districts in consultation with the state. So we don't govern that. We do interact with them, but the school districts and the state make those decisions with consultation from us. That's also true of CU. Places of worship, the capacity goes down to 25% or 50 people, whichever is fewer. Restaurants, 25% or 50 people indoors, and outdoors, 6 feet spacing between patrons. Offices go to 25% capacity. Gyms and recreation centers, 25% capacity or 25 people indoors, whichever is fewer, and that's per room, and outdoors in groups less than 10. And you may note that seems a little weird. We are trying to work with the state to understand why outdoor numbers are lower than indoor numbers. There also appears to be a situation where if you're in an outdoor space that's attached to a building, like a courtyard, you can have 25 people, whereas if you're in a field 40 feet from the building, then you can only have 10 people. So we're still working that out, but for right now, understand that your indoor spaces are 25% capacity or 25 people indoors, whichever is fewer. Group sports, outdoors in groups less than 10, no contact. Another note here, school-based sports are managed under a different set of guidance, and so I can't speak to those. I will also note that group sports indoors are not allowed at orange or high risk. Regardless of the sport, it's not allowed indoors. Retail is at 25% capacity, personal services at 25% capacity or 25 people, and events, indoors, 25% or 50 people with the calculator, outdoors, 25% or 50 people with 6-foot distancing. So this is the same slide that I had last week, but I still think it bears repeating, and it's the way we get back to yellow, or what used to be called level 2. Require mask use in your businesses. Follow state guidance. Wear masks, wash hands, socially distance, and limit group gatherings. That's the way we can do this, get back to where we were. I'm ending on pep talks. The other thing I want to mention is the exposure notification system. We talked about a little last week. It is, there's a lot of information about how it protects your privacy. It uses Bluetooth signals to figure out if you've been near another person who tested positive and has informed the system that they have tested positive. And it really is a great tool for tracking and tracing. So I really encourage that you use this. And that link there should take you to that. And you can also go on the App Store for Android. And I understand that for iOS or Apple products, it actually just asks you if you want to join. It's not even an app that you have to download. Finally, please continue to join us for these. I'm sorry that they are a source of late breaking news, but I appreciate that you all do come here for this. And also a reminder, as Corinne said, that at 4 p.m. we'll be doing a gyms and recreation center focused session. And then our Spanish language session in collaboration with the Latino Chamber is being recorded today and will be released tomorrow. Finally, if you have questions, comments after this, please don't hesitate to email us at covidbiz@bouldercounty.org. And if you have complaints or concerns, you can call the call center. With that, happy to take questions.
Great, thank you, Jesse. All right, so there's a lot of capacity questions. I think this is the first time capacities have changed for some of these industries. So it's been a while since retail, recreation, personal services, manufacturing have seen capacity changes. So this order change affects basically everyone.
Yes. And I think the important thing, since it's been a while since we've discussed capacity is based, unless it says it's based on the social distancing calculator, it is based on your fire code capacity. Each room in your establishment should have a fire code capacity. You are at 25% of that, or the number of people noted in the guidance, whichever is fewer.
So when, the new chart says 25% or 50, something, or 25, it always should have the side note, whichever is fewer.
Yeah. And thank you for that, Corinne. And if you do choose to check out the public health order itself, if you want to read a long document, it does clarify or fewer in each of those categories.
I'm actually going to put the link to the public health order into the chat. It is a long document, but the order in of itself goes into a lot of detail. Again, it defines critical versus non-critical manufacturing. It's been a while since we've had to do that. This affects offices that are running at 50% capacity that now have to move back to 25% capacity. We have a scenario here, office situation. They're usually a 6-person office with limited outside clients. Does this mean now they're 1 to 2 people, and how does that affect, clients coming in?
Yes, they are at 1 to 2 people. And I would say if they have clients coming in, that counts towards your capacity. So if you can schedule your clients, and obviously if you have a specific situation, please do email us. We can go into detail, but generally if you can schedule your clients so that only one person is in the office, that would be helpful.
Okay. And then restaurants, the indoor capacity, it's 25% or 50 people, whichever is lower.
Yes, absolutely. And that reminder there that group gatherings are 10 people or fewer and only 2 households. So this came up last week with restaurants. That means that a table technically should only have 2 households at it. You do not have to check IDs and figure out if everyone is from the same household or same 2 households, but just a reminder to encourage you to limit group sizes at those tables.
And one other change for restaurants that comes with this order is the change in service of alcohol, correct?
I'm not actually aware of that. I did not see that. If you know more, please. I apologize. I didn't see that.
I have it in the order. Let's see. Under level orange, safer at home, high risk restaurants, pursuant to Executive Order D, on-premise licensees must cease alcohol beverage sales to end consumers for on-premise consumption for takeout between 10 p.m. and 7 a.m. each day.
So that's now across the county, 10 p.m. Gotcha. Okay.
10 p.m. Counties can be more restrictive, but cannot be less restrictive. So in this case, in the restaurant area, it does affect more than just capacity. It does affect the sale of alcohol. We will make sure we get that out to the restaurants. All right, let's get, and this goes into effect on Friday. Is that Friday morning, Friday evening?
I will read I'll take a look at the letter itself, but it is Friday. I'm pretty sure it's Friday morning. It just says effective Friday, November 6th. So I would say when your business opens on Friday, November 6th, it needs to be in compliance uh, with level orange.
Okay. So you said that Boco or Boulder County is at a 5% positivity and it's higher by age in some age groups.
Yes.
Can you clarify what is meant by this? Did this person mean something in this or miss something in this explanation?
Sure. I think, first of all, again, 5.4 is our current 2-week rate. So it's spread out over 2 weeks. If you go back to my key takeaways here, I'm just using this to grab notes that are down at the bottom. Testing numbers have remained high with a 14-day average of about 1,215 tests per day. Our 5-day rolling average positivity rates are currently at 6.1%. So again, there's a difference between the 2-week incidence rate and the 2-week positivity rate and the 5-day positivity rate. And most age groups are seeing greater than 5% 7-day average positivity. So it's more just sort of as you take each age group, you see there's less smoothing of the curve basically. Also, over a 2-week period, we benefit from the fact that we had very low positivity 2 weeks ago, and now we're seeing a spike. So it's partly time frame. It's also partly as you group the population together, it smooths out and lowers the average a little bit.
And on the hospitalizations in Boulder County, but across the metro area, hospitalizations remain high and they're increasing at scary rates, which is one of the reasons this doesn't show that necessarily.
Yeah, this does not help. Again, so
if you look at today's, the metro area is red. Boulder's not red, but almost all the other metro areas. So that's how quickly some of these things are changing. But I think this slide is from a day or two ago.
Yeah. Yep.
So hospitalizations are an issue across the metro area, and it's something that is one of the key indicators that we need to monitor, because if we don't want to overstress our hospitals, especially as we enter the winter.
Right. Once you overwhelm the hospitals, that means that not only are patients who need COVID care unable to receive it as easily, but then that also affects all other intensive care issues. So one of the metrics that our department really focuses on is how many beds are available, how much service is there. That was the whole point of back when we talked about flattening the curve. The whole point was to reduce impacts on hospitals.
And so some of the reasons that were shared with Boulder County of our move are that the current trajectory for the modeling reports that they just did show that we're going to see what the peak hospitalization that we had back in April, we're going to hit that mark next week, and that we will reach capacity for our ICUs in mid-January. And if we see increased contact over the holidays, which is very likely with Thanksgiving and Christmas and New Year's, that we potentially will see that ICU capacity exceeded in December. So that's the reason why the state is making some of these decisions. I think we still struggle significantly with how they've made and communicated the decisions. Not necessarily that it's the wrong decision, but that we've had no advance notice to work with our community. All the things that we thought we were going to be doing this week of working on a mitigation plan, now we're just getting a decision that we're going to this this new phase on Friday. So that frustration we share wholeheartedly with you. And it's really unfortunate how the communication is still not happening effectively.
So Jesse, there's a little confusion about the personal gathering order and then the orders that are underneath each of the sectors. So there's the personal gathering order of no more than 2 families,
10 people, no
more
more
than
than
10
2
people from 2 families that are in a personal gathering. And that relates to restaurants and the fact that you're in a personal gathering when you go to a restaurant and you sit together.
Yep.
We have a question from a limited healthcare or a personal service where you might have 2 therapists and 1 child, and that's 3 households, but that doesn't apply there because they're following the orders for limited healthcare, for example.
That's exactly right. The way that the order is written, the personal gathering limitations are in place except where the activity you're participating in falls under another category, and this is a key part here. You are complying with each part of the guidance. So one of the things that came up with a lot of gatherings around Halloween was if you can't do all of the required guidance, if you can't commit to all of the required guidance, then you are not in compliance with the order. All of a sudden you have 100 people gathering together and they're not getting symptom checked. Well, in that case, you're way over your 10-person 2 household gathering.
So, we have capacity limits here, but we also you need to follow the orders. You need to follow the symptom checks, the, social distancing, those pieces of it.
Mm-hmm.
I think it was a real estate company or an accounting company that wanted to do a staff meeting of 9 people outside socially distanced. They're sitting at a park, and they were worried that was going to be against the order, the personal gathering order, but that falls under the office or the general rules of an office, less than 10 people. They went outside, they wore masks, they maintained social distancing. They had done their health checks that day. They're still following the right order in that case.
Yes. Yeah.
That's and we really want to see businesses doing things like that they're doing everything they can to minimize exposure. Those aren't the concerns. It's the people that throw a big Halloween party or are having lots of birthday parties for their kids still and having everybody in close proximity. That's the stuff that is now impacting the businesses. The decisions of the community and how they're behaving are now unfortunately impacting our business community. And it's not fair. And I wish it wasn't happening, but that is exactly what is happening. So it is important for everyone to realize the impacts of their actions on the broader community and for people to stop being selfish.
So more capacity and code questions. We knew this is going to be the case.
What we're here for.
This is the big change. Exactly. That's what we're here for. So if your fire code says 800 people and you now move down to 25%, which is 200 or 50, the number is 50.
Yes, absolutely.
Yeah, unfortunately, that is how it's going to roll out.
And then I've had a lot of calls from businesses who don't know what their fire code is. They can't get a hold of their landlord. They want to call the fire department. And I'm thinking that's not sure the fire department has a listed fire code for every room in the city. What should be a general rule for those businesses as they want to follow follow these rules, but they can't find their fire codes? What should they do?
That's a great question. I don't have a quick answer. If you are in a municipality, I spend most of my working months as a land use planner. So I can tell you that Boulder County does not keep track of your fire code capacity, but the municipalities may because they keep track of the various spaces within buildings much more closely than the county does. So within the municipalities, it may be worth contacting the planning department or the building department for your municipality.
And you can certainly, just reach out to our team as well. We can certainly work through some of those one-on-ones, assuming all 8,000 businesses don't call us. But
I was working with a retailer earlier. They said their square footage. Then you start looking at, like if you're giving a certain amount of square feet, you're,
Yeah, we can figure out some reasonable numbers
Yeah.
to work with people to. Obviously, a really small place isn't going to fit 50 people. So the space calculators can be a good guide for you of what's a reasonable amount of people to be in there anyway. And that can be a way to do that. Also, depending on what you're doing, like a place of worship that has seated individuals can space families, without having the same space as someone who's got activities where people are really moving around a lot. So again, there's some site specific things that we can probably help try and figure out what that is if you don't have any other idea.
That actually is a really good point. And to go back to the person who asked about the 6-person office, remember, it's not just the number of desks you have. If you have a big open area, you may actually have a higher capacity based on your fire
Funny
code.
because that person wrote back and said, well, actually our capacity is 12.
Then
Bring
there
in
you go.
6.
So you can have
So
3
we
people.
actually are probably, almost 2 or 25%. So you might have a lot more space for a lot more people. Just make sure that they're distanced out, and you can it's not 25% of your normal employee count. It's
Right.
25% of the capacity of your space.
Right.
I'm glad that came up because I was wrong. So I really appreciate. Yeah, that's exactly
And
right.
apparently, if you go to International Fire Code, there's a calculator when you Google it.
And usually those numbers come out fairly high. So you're probably going to start to run into the other numbers being more limiting too, unless your space is really huge. Then again, you're going to just be at the 50.
And you want to take into account your desks and all that stuff just to make. So on that 50 or 25%, there's no exception for places of worship?
Nope.
Yeah, I think the one exception might be life rights events. So again, that we'll have to look into that a little more, but I'm not sure if that got changed for life rights then, because those were being treated different than just a weekly worship.
Right.
And then the chart you gave, or you gave, talked about manufacturing, but there is a difference between manufacturing and critical manufacturing, correct?
Yes. And basically critical, anything that is adjudged to be critical, and there's a list in the order. If you are judged to be critical, your capacity limits are different, and they're basically more like you need to socially distance, you need to be wearing masks, you need to reduce the number of people in the space as much as feasible without affecting operations.
And I put the link of the order in there, but the list of what's considered critical manufacturing, I think we said was page 34 of that order.
Yeah, I think that's right.
So it's like Appendix A.
Yeah, Appendix A starts on 33.
33. So if you're we went through this early on when we were doing safer at home and reopening, that are you critical manufacturing, or are you not critical manufacturing was one of those designations early on. We're coming back to that a little bit again. So if you need to look at whether or not you're critical manufacturing, the order does designate which ones are considered under critical manufacturing.
So I want to address one thing for houses of worship and life rights. Indoor, it is 25% or 50 people, whichever is less per room. For seated events, it's the same rule as it was before. Seated events, you don't use the space calculator. You can have people within, or groups of people within 6 feet of each other. The one difference is outdoor worship services shall operate at the same level as level blue. So that's level 1 under the current. So that's a big change, actually.
So here's hoping for really good weather through the next couple of weeks.
This week for sure.
Yeah.
Speaking of which, how long, crystal ball time, how long are we looking to be in this level?
So the way that the letter is written, and I'm not going to give you a time frame. I will just say that in order to move out of this time, out of orange back to yellow, we need to maintain yellow level metrics for 2 weeks. So our 2-week incidence needs to be 75 to 120 cases per 100,000. It needs to be 5% or lower positivity, and our hospitalizations need to be declining.
So first we have to get back to 75 to
Yes.
175
Yes,
because
exactly.
we're closer to safe or stay at home numbers right now in the high
That is
300
correct.
or middle 300s.
Yes.
So first as a community, we need to get those numbers down, and then we have to maintain the yellow for 2 weeks.
Yes. And then at that point we can talk to the state and say, can you let us back? And they make that decision.
So because businesses need to plan more than 2 weeks out.
Oh,
and
absolutely.
especially for the holiday season and your staffing and all of that stuff, we're planning for quite a few weeks here.
Yep. Yes.
Yeah, we're not even able to start the 2 weeks, obviously, until we hit that mark. So it still remains to be seen. Once we get to that point, now we start our 2-week clock.
So is there a day every week that they assess those numbers?
We look at them every day. And the state has on their website is updated daily as well.
And just to clarify, do employees count towards reduced capacity? So a restaurant that can seat 44 can only seat 44 minus employees?
No, that's a great question. Excluding staff. So restaurants are like rec centers. They don't include staff in that number.
Okay. And this change in the booze curfew, as someone called it, or the, selling alcohol past 10 p.m., that's because we moved down to orange. In yellow, it was 11. If we moved up to blue, it's 12. It's, those timeframes are based on what level on the dial you're on.
I think there's going to be consistent across the metro area that you're going to see that 10 o'clock is going to happen across the whole metro area. So.
Okay. What are the repercussions of non-compliance? The person here said, of course, we're going to comply, but what are the repercussions? What happens to a business if they don't comply? The state law, locally, what happens?
So we'll work with you to try and come into compliance, but the maximum, the county has the ability to sue, and municipalities and the state have the right to take your business license if you don't comply. So what we're looking, we start with communication and cooperation. We have not taken anyone's business license. We've not asked the state or a municipality to take a business license. What we're looking for is to try to do what we do at these webinars, which is show you why compliance is important. We've had a number of types of, activities, people gathering together that have caused us to slide, and that's now affecting our businesses.
We have one business that was basically ordered to comply and elected to shut down instead of complying. So we did not shut them down. They shut themselves down. There's a business that their business license is sort of on probation. So pending any further action, it could be revoked. So it's not the first step, but it is a possibility.
What about compliance in the public? People that aren't complying with, the orders, that personal gathering, or the public not complying with mask orders.
I can say specifically the city of Boulder has had probably some of the most aggressive. So they're ticketing people for violations. The city orders also incorporate all of this stuff. So those tickets can face criminal charges, certainly fines and other pieces. When we were dealing with the surge with the university, there was a significant effort there. So there's been a lot of tickets issued related to that for the Hill and for other properties, but they've seen activities outside of that in other parts of the city. Similarly, other municipalities have the same ability to do tickets for individuals that are violating the public health orders and violating those issues. So.
And there's been some inclusion of public health in some of the municipalities' nuisance orders. So in order to make some of these, in order to enforce some of these rules.
Public health has also deemed certain properties as nuisance properties for risk of communicable disease. So our ability to basically vacate those properties, we can come in. So we are in the process right now. We have a number of properties that the next step will be to vacate them. So they have no more leeway to have anything go wrong.
So Lane, you referred to a letter, and Jesse and you both referred to a letter. I think somebody's asking a letter from whom, and it's a letter from Joe Hunsaker Ryan, the director of CDPHE, basically saying that Boulder County must move to level orange, correct?
Correct. You can share that if you wish.
I will forward it on with the FAQs, the letter, yep, I didn't have that when I forwarded on the notice, so I will forward that on with the reply to this email or to this webinar. Are the staff exclusions also from the capacity also applicable to retail as well and personal services?
So I will take a look, but I did not see that when I was looking before. It just says may operate at 25% of posted occupancy limit for retail, and for personal services may operate at 25% of posted occupancy limit, not to exceed 25 people, whichever is less per room.
How about capacities for essential retailers such as grocers? Is there a change there between the two?
There is not a change. So again, critical retail falls under that Appendix A, and I'm going there now. Scrolling to try and get there. Basically, just as they're operating now, they need to operate. Everybody needs to wear masks. They need to enforce social distancing, and if they can limit capacity, basically it says they need to comply with all public health orders currently in effect to the greatest extent possible, and will be held accountable for doing so.
And while we're on personal services, let's take one of the, we had this early on. Personal services encompasses like 20, 30 different categories. But let's take body artists. Body artists can continue to stay open at a limited capacity at 25% capacity, but they also have to follow the other order parts, appointments, no guests with their clients, they have to follow the masks, all the masks and, safety protocols. They can stay open, just have a more limited capacity within
Absolutely.
the space.
Yep.
Same thing with hairdressers and massage and pet groomers and a lot of those personal services. Do you foresee us moving to stay at home again?
I guess refuse to make predictions.
Yes, I was about to say.
I certainly hope not. We're still fortunate that we're in a little better shape than the rest of the metro area, but we know that there's impacts that cross borders. So people live in one county, work in one county, recreate in another county. So so the potential for continued increase in disease is there. So we don't want to see that, but yeah, I don't think I can make predictions. I mean,
someone asked if shoes and clothing is considered critical retail, and again, I would suggest going to page 33, 34 of the order. I don't see it.
Yeah, I would say unless they're selling specifically to, like law enforcement or,
hospitals or
like that. But yeah, if you're providing them equipment, then yes, but otherwise, no.
Clothing and footwear companies can still stay open, just at the reduced 25% capacity.
Yeah,
Absolutely.
there's none of the businesses are closed. So as far as, can you do this? Like, yes, you can operate. It's just there's unfortunately tighter restrictions.
Sorry. All panelists, I'm going to post the order right now to everybody. So are you extending the Stasio testing site?
It's moving, if I remember correctly. Is that true, Lane?
Yeah, let me pull that up.
So there is a site open until the end of the year in Nederland and Lyons. It's a drive-through site through the end of the year in Nederland and Lyons. And then there is the Stasio site was extended. I know that.
Yeah, to November 8th though. So I don't know if that will extend beyond the 8th at this point.
My understanding is that they're looking for a way to keep the people warm who are there all day. So that may cause them to move. But we're, as far as I can tell from listening in on conversations about this, they're committed to continue to offer that service.
And there are still other resources beyond that. So if you on our testing page, I'll post a link to that. It does share a lot of the different testing locations throughout the metro area.
And I sent it out with, I think, one of yesterday's emails. I think I ended up having to send 3 emails in the last 2 days because there's been 3 different changes. But the testing, it had the Stasio, it had the Nederland and Lyons, it had a link up from the Boulder County site and a link from the state of Colorado site, because the Water Roll site is still open in Adams County as well. Let's go to sick employees. Let's change directions just a little bit. If an employee has a symptom, but not one of the major ones like a sore throat or fever, they're getting tested. Do they need to quarantine? Do they still need to quarantine?
So the way that the state explained this, and you can always be stricter, the state explained it as if you have 2 of the minor symptoms or 1 of the major symptoms, you need to quarantine.
Yeah.
And that's if you don't know you've had direct exposure to someone else. If you've had direct exposure to someone else, the quarantine time's 14 days, period.
Regardless of whether you have a symptom. If you've had exposure and it's been identified by either a conversation with your employer or a conversation with public health or either the state or the county, you need to quarantine for 14 days. There's no testing out of that 14 days.
And I know it's really confusing, the kind of the jargon that gets thrown out. So isolation is for sick people. Quarantine is for people that were exposed, that were concerned could become sick.
Right.
So isolation is for sick individuals. Again, if people haven't been tested positive and they're being excluded for their symptoms, now you're looking at those symptoms to resolve. If they haven't tested positive, if they test positive, now they have to follow all the isolation components.
And that's a really, thank you for that. Like the important thing is, if you're 10 days into your 14-day quarantine after an exposure and suddenly you develop symptoms, you need to remain in quarantine, I believe, because you haven't tested positive yet. Isolation, okay. You need to go into isolation until you have no symptoms, correct?
Yeah, you should get tested at that point.
Yeah.
So if you develop symptoms during your 14-day quarantine where you had been asymptomatic, develop symptoms, at that point get tested. If you test positive, then you're going into isolation, and you're in isolation until you're symptom-free for a certain period of time. I also I've gotten a lot of questions of quarantine versus isolation, and I was exposed to a person who may have been exposed to someone else and is quarantining. Am I also quarantining? And do I have to tell my employer? Do you have to have direct exposure to the positive person?
Correct. I think that the challenge is you shouldn't be exposed to somebody who's quarantining, because then they're not actually quarantining. So that does potentially make you a risk if they become sick. Certainly, and it was within 2 days of you being together. Now you're one of their high risk exposures, and now you would need to quarantine. So people who are quarantining shouldn't be going about their normal day-to-day job and operation. They need to be staying away from everybody because of the risk of them becoming sick and giving it to others.
I think most of the cases are this person just found out they have to quarantine and I saw that person 3 days ago. Now am I?
No. No contact of a contact. There's no, removal, that many removals. We're focused on your exposure to someone who is ill or could have been ill at the time that you were exposed. So again, people can be shedding the virus 2 days before they show symptoms. So that's the other challenge. So that's, I think, where some of the exposure is happening is people don't feel sick. They're exposing themselves to other people. And then they find out they're sick later and they've exposed a lot of people. So it's the other just kind of nasty thing about the virus.
Do people need to quarantine if they've traveled to another state?
No, it's a good idea to be very cautious when you're doing high risk activities like that, but there's no travel quarantine.
And if people are asked to quarantine, and this is a question that comes up a lot, and we might need to do some sort of information on this. Are there financial resources or emergency sick pay for those individuals? And the answer is
no. I do know that there were resources available from the federal government and from the state at one time. Corinne, you may have better access to that than I do.
Yeah, I just looked. It used to be that there were, if you're required to quarantine or certain things that you qualified for certain assistance. Right now, it depends on whether or not the employer offers paid sick leave or sick leave, and that's under the Family First Corona, the FFCRA, or if you have your own, paid sick leave policy. So I think that's dependent on the business. And it's something that if you need help, you can contact me and I can put you in contact with whether that's free, HR services or legal services to determine whether or not you offer or are required to offer those types of services to your employees. FFCRE, employer paid leave. It's Department of Labor has a site on it, but not every employer is required to offer that. There's less than 500, but then some less than 50 also don't have to. So I think, I'm not a lawyer, I'm not an HR expert, but there are some resources out there are required or other pieces.
Yeah, it's in a lot of ways related to the Family and Medical Leave Act. So it's also another place to look.
So I'm going to put in somebody put in the link to the Department of Labor FFCRA information. I'll put it into there. Does the governor's office or any other government officials have any insight on, I guess, I don't know if you're going to answer this one, on financial support for businesses that have been or continue to be hit hard by all of this?
I cannot answer that question. I'm sure, I know at the federal level there were ongoing discussions, and I'm sure at the state level, there's a search for emergency funding.
And the governor's new budget proposition that he put out this week, because we are performing better than was expected when the budget was passed, does put in a little bit of a stimulus for highly impacted individuals and businesses. Now that doesn't necessarily mean it's passed, but there is this idea that Colorado is looking at highly impacted businesses and individuals. But at this time, there are a few grant programs still open. There's one for restaurants through Excel Energy. Energize just finished. I believe Lafayette and Louisville had still some opens for their CARES Act funding. But as we get more information on additional resources that become available to businesses, I know all the local chambers are trying to push that information out as quickly as possible, one of the top things we're asked for. All right, we're going to try to finish this up in 5 minutes because we have the gym call. What government group or officials is ultimately responsible for making these calls to increase or decrease restrictions on move along the dial?
It depends. Sorry, Lane, you should answer this question.
The Colorado Department of Public Health and Environment.
So CDPHE, the governor's office, or the Colorado Department of Public Health, the governor. Okay, so the FFCRA requires applicable employers to provide paid sick leave. I guess this goes back to the FFCRA, and there's questions as to whether or not they need to issue a letter to individuals that are required to quarantine. Have you seen businesses having to issue letters to individuals required to quarantine? Is there any sort of language anywhere that says they must quarantine for 14 days because they were exposed?
There is language that says, so if you go to covid19.colorado.gov and look up sick employees / outbreaks, there's language in that section that comes out of work from CDPHE that just says, if you were exposed or if you were sick, you need to quarantine or isolate depending on the situation.
Okay. So we're talking again, outbreaks, sick employees. Is closure mandatory if you have 2 positive cases in 2 weeks, even if it's determined that those cases are not related or connected to your business?
So again, the state is requesting that you close and then contact us. So yes, closure is required. However, it may be that in the phone call right after you close or as you're closing, we'll say, oh, that person works weekends in one part of the building and this other person works weekdays in a totally different area of the building. They are not related. You do not need to close as long as you can clean those spaces. So I think it really depends on the situation, but the closure is really a chance to sort of reconvene and check in with public health.
Okay, we're going to go back to quarantining and sickness again. If someone tests positive or becomes sick, how many days back prior to confirmation of illness do you need to go back to begin quarantine or figure out how far back they were exposed? Or is that something that you work with public health department on to figure out in the contact tracing, to figure out who was that direct exposure, who needs to quarantine, and when that exposure might have happened?
That is absolutely right. You can work with public health. Our epidemiological team is working as hard as it can to reach out to every positive person in the county. It's a pretty overwhelming task at the moment, but they're doing that. They are reaching out, but it is, I think if you are the person that tested positive, go into isolation immediately. If you just personally know that you were around someone who recently tested positive and had to go into isolation, you can contact us. You can also talk to your employer and just say, I was a close contact, I need to go into quarantine. Just as a way of hedging your bets there. That'd be my recommendation. Lane, you may have better.
Yeah, I agree. I think right now the case counts have overwhelmed the capacity of the epi team. There's no additional assistance from the state, and that's consistent across the entire metro area. So the ability to do all the trace investigations and case investigation work is beyond what the capacity is. So if you're sick, you should alert the people that you may have exposed. That's going to be faster than the system now to be able to identify all those folks. So it is going to take people taking the right actions to help prevent the further spread, because there's more illness than can be addressed right now.
And direct exposure. So not I walked through this hallway to get someplace, I need to let every business along this hallway know, but I was within 6 feet of this person for more than 15 minutes. We know we were without masks. We were and were not, things like that. All right, we got to close up. Last thing, could you show slide number 3 real quick again?
Ooh, now you're asking me to
That
remember
was the case positivity. Or the,
Oh, yeah.
There you go,
Okay.
that one.
Yep.
All right, that was just the question. Can you show
Okay.
that slide again? I know we didn't get to every question. We have to move on to the gym call, but we will have a call on Friday at 1 o'clock. Adjust the material. I'll send out the recording to this, the slides, the information, the frequently asked questions, the order, look at it, decide whether or not you have more questions, and then we'll have a 1 o'clock call on Friday. And in the meantime, please do feel free to reach out to that covidbiz@bouldercounty.org or my email with any questions that you may have as we move to Orange on Friday. So thank you both.
Thanks, everybody.
See you in 1 minute.
Yes. Bye.